White bread and other refined grain products, such as white rice, white pasta, crackers, and many breakfast cereals, are staples in many modern diets, often regarded as harmless or even wholesome due to their widespread availability and historical use. However, these foods have been stripped of most of their nutritional value during processing, and their regular consumption poses significant health risks. Unlike whole grains, which retain their bran and germ, refined grains consist primarily of the starchy endosperm, offering quick-digesting carbohydrates with very little fiber, protein, or micronutrients. This nutritional emptiness, combined with the way they affect blood sugar and metabolic function, makes refined grains one of the most harmful long-term contributors to modern chronic diseases. One of the primary concerns with white bread and refined grains is their high glycemic index. Foods with a high glycemic index cause rapid spikes in blood glucose levels after eating, followed by a steep drop as the body releases insulin to bring sugar levels back down. This yo-yo effect on blood sugar is taxing on the pancreas and contributes directly to insulin resistance, a condition in which the body's cells stop responding properly to insulin. Over time, this can progress to type 2 diabetes, especially when refined grains are consumed frequently, as they often are in standard breakfasts, sandwiches, and snacks. People may not even realize how much refined grain they consume, as these ingredients are disguised in everything from cookies to pizza dough to granola bars. Beyond blood sugar spikes, refined grains lack dietary fiber, which is critical for digestive health, appetite regulation, and cholesterol management. Fiber slows the absorption of glucose into the bloodstream, reducing post-meal blood sugar spikes and helping people feel full longer. Without it, meals made with white bread or refined pasta digest quickly and leave people hungry again soon after eating, often leading to overeating and increased calorie intake. This can create a cycle of constant hunger and snacking that leads to gradual weight gain over time, particularly dangerous when combined with other high-calorie, low-nutrient foods. The lack of fiber also impairs bowel regularity and increases the risk of constipation, diverticulosis, and colon cancer. The nutritional depletion of refined grains goes well beyond the absence of fiber. During the milling process, the bran and germ layers, where the bulk of vitamins B1, thiamine, B3, niacin, B6, folate, iron, magnesium, selenium, and zinc are located, are removed. This leaves a pale, soft product with little to no natural micronutrient content. Although some refined products are enriched with synthetic vitamins and minerals, these are not always absorbed by the body as efficiently as their naturally occurring counterparts in whole foods. Moreover, enrichment cannot replace the complex synergy of nutrients, antioxidants, and plant compounds found in intact whole grains, many of which play critical roles in reducing inflammation, supporting immunity, and protecting against oxidative stress. Refined grains also contribute to chronic inflammation. Diets high in rapidly digesting carbohydrates are associated with elevated levels of inflammatory markers, such as C-reactive protein, CRP. Chronic low-grade inflammation is a known risk factor for a multitude of conditions, including cardiovascular disease, cancer, Alzheimer's disease, and autoimmune disorders. The inflammation caused by high intake of refined grains may not produce immediate symptoms, but over the long term, it silently erodes health, weakens immune defenses, and accelerates biological aging. Heart health is another area of concern. Replacing whole grains with refined ones has been shown to increase the risk of coronary artery disease. Studies consistently show that individuals who consume diets high in refined grains have higher triglyceride levels, lower HDL, good cholesterol, and greater abdominal fat accumulation, all of which are major predictors of heart attack and stroke. Whole grains, on the other hand, are protective against these outcomes, primarily because of their fiber content, slower digestion rate, and higher levels of plant-based nutrients that support arterial health and reduce oxidative damage. The dangers of refined grains are particularly relevant in children and adolescents, whose eating habits often include white bread sandwiches, sugary breakfast cereals, and white rice-based meals. Early and frequent exposure to refined grains can impair the development of healthy metabolic patterns, setting the stage for obesity, insulin resistance, and elevated blood pressure later in life. Worse still, These foods displace more nutritious options like whole grains, fruits, legumes, and vegetables that are essential for growing bodies and developing brains. From a behavioral standpoint, refined grains also contribute to food addiction and overeating. Their soft texture, bland flavor, and quick digestion make them easy to consume in large quantities without feeling satisfied. They are often paired with sugary spreads, salty processed meats, or fatty condiments, compounding their harmful impact. Because they trigger a rapid dopamine release in the brain, similar to that produced by sugar or fat, they reinforce compulsive eating patterns. Many people find it difficult to stop eating foods made with refined grains, even when they are no longer hungry, further promoting excessive calorie intake and weight gain. Another hidden problem is that refined grains are often heavily processed with chemical bleaching agents, dough conditioners, and preservatives to extend shelf life and maintain appearance. Compounds like potassium bromate, a suspected carcinogen banned in many countries but still allowed in parts of the United States, are sometimes used to strengthen dough. The cumulative effects of consuming these additives over time are not fully understood but raise additional safety concerns. In conclusion, white bread and other refined grain products are not benign dietary staples. They represent a heavily processed, nutrient-poor food group that undermines metabolic health, contributes to chronic disease, and displaces more beneficial whole foods. Regular consumption increases the risk of blood sugar instability, insulin resistance, obesity, cardiovascular disease, inflammation, and digestive problems. While occasional intake may not be harmful, making refined grains a dietary foundation is a recipe for long-term health decline. Transitioning to whole grains like oats, brown rice, quinoa, and whole wheat bread is one of the simplest yet most powerful shifts you can make to support blood sugar balance, digestive health, and overall vitality.